This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Rocky Mount Family Medical Center. Tonight we have Dr. Alston with us. He is a dentist that puts on braces. What's that called? An orthodontist.
That's right.
I'm fired already. An orthodontist. He's not only an orthodontist, he's the orthodontist that takes care of my granddaughter. So you know he's got to be great. And we're going to talk, he's got a new something that he's going to be talking about, and I am really excited because it's going to help a lot of my patients. And it's pretty interesting, and I don't know all about it, but he's going to be talking about it. So welcome, Dr. Alston. It's good to see you again.
Thank you very much. I came a while back and talked about braces.
That's right.
Both children and adults, and that is exactly what I do 95% of the time. And that's what I love to do, and I've been doing it for 25 years. And again, remind people that I am a general dentist by training. You have to be a dentist before you can pursue a specialty.
Right.
So I have a background as a general dentist and as an orthodontist. But as you said, I've come back here tonight to talk about something completely different that most people might not think about as part of a dental scenario.
That's right. I certainly didn't.
And I'm going to give you a little anecdote as to how this came about for me. As a member of the Southern Association of Orthodontists, I was responsible for planning our annual meeting one year. And I had to make a field trip to Hilton Head to check out the facilities.
Right.
And one of my buddies, an orthodontist from Winston-Salem, went with me, and to save money, we shared a room. Well, I had never had the opportunity or misfortune to try to share a bedroom with someone who snored.
Oh.
It was just about, maybe the longest night. It was unbelievable. After that experience of trying to go outside and walk the hall, going downstairs and getting a drink, coming back up and sitting on the balcony trying to read myself to sleep, the pervasive snoring made it literally impossible for me to sleep. Now, he seemed to be sleeping okay. He was just rattling the roof, and that was a horrible night. And I had never ever experienced that. Now I'm thinking, well, I wonder what a bed partner, a real bed partner, is like, sleeping right next to somebody who does that. It must be miserable. Well, the second part of the story is I go back for another field trip to the same place, to Hilton Head. Another orthodontist, a fellow from Raleigh, a buddy of mine, comes down. We have to share a room again. And before he gets in bed, he opens up a suitcase and takes out a mask, puts it on his face, hooks it up to a tube, and plugs it in and turns it on. And it looks to me like a breathing machine. And actually, that was fairly pleasant for me because it was like having waves and swishing sound in the background. But it was the only way that he could sleep. And this is a CPAP machine, continuous positive air pressure. So in that experience of going basically for an orthodontic meeting and having to spend the night with someone who snored and someone with a CPAP, I literally never knew about the disease at all.
Really?
And then I decided I was going to find out about it, and then lo and behold, at our next North Carolina meeting, a fellow comes in and his presentation is on dental or oral treatment, oral appliances for treating obstructive sleep apnea.
Really?
And so I decided to follow it up. I went to his course, I was tested, and then lo and behold, I have moderate sleep apnea myself.
Oh my goodness.
I was fitted with a device, and now my fiance can tell you that if I wear this device, I don't snore, and if I forget to wear the device, I get poked in the back to put it in. And so that's my experience, and that's why I became interested.
Let me just back you up 1 minute. So didn't you say, when we were talking earlier, you said that you had done some testing and you didn't qualify for the CPAP?
Well,
for whatever reason?
Well, what I had done is I tested out as moderate, okay, and at least in this day and age, an oral appliance for mild to moderate obstructive sleep apnea is considered the equal or almost the equivalent as a CPAP. The discussion we were having is about qualifying for insurance. And because I wasn't overweight, the insurance disqualified me for covering the appliance. And we'll talk about that in a minute. And that's one of the things that's a little bit difficult when dentists try to enter this realm, is because this is in fact a medical problem.
That's right.
Now,
Medical diagnosis, yep.
so what I've got is a series of slides here.
Okay.
And we won't beat them to death, but I wanted
right.
to go ahead and put the first one up, and we're
Okay.
just going to talk about the magnitude of obstructive
Awesome.
sleep apnea.
Awesome. Oh, there you go. Lee's
Right.
on top of it.
That's right. Now, chronic sleep disorders, including sleep apnea, 50 to 70 million Americans. What we're going to talk about tonight, which is obstructive sleep apnea, affects more than 20 million Americans. And 93%, 82% people with moderate to severe obstructive sleep apnea remain undiagnosed.
Oh,
so
that's
this
not
is
good.
kind of one of those silent diseases.
Right.
The next slide goes into a little more detail about the numbers. 1 in 4 men, 1 in 10 women. We discussed this earlier.
Right.
As women age, this number starts to equal. Women with age, typically around menopause, will tend to have a higher rate of obstructive sleep apnea. Middle-aged people with severe apnea are 46% more likely to die of a heart attack.
Oh, man, that's bad.
This is what I had no idea. I had no idea of the magnitude of this disease. So the next one is actually, we're going to discuss what is obstructive sleep apnea. This is what we're talking about tonight.
Okay,
This
good.
is not narcolepsy. This is not insomnia. You know a lot about that. Most of the public knows about that. And in fact, if anybody wants to add to this and call in and tell us about sleep hygiene.
407-1111.
Right, because what we're talking about is an actual obstruction of the airway. And so I'll read this. Obstructive sleep apnea occurs when tissue in the back of the throat collapses and blocks the airway, reducing the amount of oxygen delivered to all the organs, including the heart and brain. Now, how do you know if you have it? We discussed this earlier. There's daytime symptoms and
Yes.
there's nighttime
Yes.
symptoms. At night, this is typically a tip-off is snoring, loud snoring. What is snoring? It's when the soft palate, if you put your thumb in the roof of your mouth, the hard palate is straight up, and if you go back and touch to where, if you touch, you feel like you're gagging, that's the soft palate. The vibration of the soft palate is what causes the snoring. When the soft palate collapses over the airway and the tongue collapses, there is literally cessation of breathing. No airflow at all.
Right.
So at night, these people are either snoring or they're gasping. They will go 10 seconds or more at times without breathing, and then they'll wake up and gasp,
Yes.
and then they'll start over.
Right.
Now, what is the mechanism of this is you can hold your breath, all right? And then when you have to breathe, it's because the oxygen is gone and your lungs are now filled with carbon dioxide. That sends a signal through the blood to the brain that causes the drive to breathe.
Right.
And these folks basically are not getting oxygen to their brain. The brain creates little epinephrine surges, all right? And that causes a drive and an arousal. And two things are of detriment here. The constant arousals all night long, repetitiously, interrupt the sleep and cause the lack of sleep. That's the nighttime issue. The other thing is these little surges of epinephrine all night from the sympathetic nervous system are what causes an increase in blood pressure.
Yep.
All right, and it also causes, it's related to insulin resistance. And that's
Really?
why we're going to find out that people with diabetes very often have OSA, obstructive sleep apnea,
right.
and people with hypertension. And this is kind
And those are such common. Oh my
Exactly.
gosh.
Now, these people at night are also waking up and going to the bathroom constantly, but mostly it's a snoring and gasping and a lot of times sweating. All right? Now, during the day, as a result of not sleeping at night, what you're seeing is daytime sleepiness.
Yes.
And this causes little micro naps during the day, trying to catch up, but mainly it's sleepiness, falling asleep at the wheel.
Yes.
Falling asleep.
At a stoplight.
Exactly. When you're riding in the car with someone and they're driving, you fall asleep. You may fall asleep watching TV. You may fall asleep if you just sit still.
Yes.
And again, we'll go on to the next slide. I think this one says, do I have sleep apnea? See if we can pull that one up. I want you to go on through that. I'm not sure we're going to do that one.
Keep going, Lee.
Okay, here
There you go.
Now,
Awesome.
this is a little misleading, but it's true. In other words, this is our stereotypical candidate here.
Yes, that's
Okay?
right. Mm-hmm.
A male, okay, with a body mass index of over 30. Body mass index is based on height versus weight. So basically, the heavier you are, the higher body mass index, and the heavier you are, and in fact approaching obesity, these folks basically are going to have obstructive sleep apnea. Obesity and this are almost linked. If you have a large neck, in other words, if a man measures a neck size of 16.5 or 17 or greater, and a female over 16, then again, this is someone who's probably primed for this. A high arched palate, this is something a dentist can look at. A large tongue and a recessed jaw. In other words, anything that keeps the tongue and the soft palate back in the throat that can possibly obstruct the airway are going to cause obstructive sleep apnea.
Fascinating.
So heavier people have more fat deposits, okay? And if they have a smaller airway, a narrower mouth, a narrower palate, in other words, it's kind of like thinking about the size of the box. You need enough air in this box. If there's something in the box or the box is not big enough, you're not getting air. Now, let's see if we want to go to the next slide. I think we will. This one says biggest pet peeves in the bedroom. And I think that this is one of the reasons that some people seek treatment
Yes.
is because
I've heard that. My wife says.
yeah, their bed partner. And it's, as I said, my little anecdote, this was not my bed partner. This was just a guy that I was sharing a motel room with on the weekend, drove me crazy. And the same thing happens to a bed partner. So this is a quality of life issue.
Yes, it certainly is.
It can make your partner absolutely miserable. Now, there are other things associated with it, but primarily, if you're looking and you're thinking, do I have this? Then you need to be thinking, do I snore? Does my bed partner snore? Does he wake up at night gasping for breath? Is he obese? Okay, does he have a large neck? And is he hypertensive? Then this person is almost definitely going to have obstructive sleep apnea.
Right.
Now, and again, the daytime symptoms, as we talked about, mainly is daytime sleepiness. There's also some irritability. It's some ways related to GERD. And so there's a lot of things that obstructive sleep apnea is associated with and seems to potentiate. And it's the numbers are simply massive.
And this is a big problem.
Oh yeah, let's talk about that.
Sexual dysfunction.
Absolutely. For men, erectile dysfunction is a property of circulation
Yes.
and blood flow and
Yes.
oxygenation.
Yes.
And we're talking about someone who snores and is not active sexually. We're talking about marriage enders here.
Yes. Oh yeah. Oh
And,
yeah.
you know, I'm not that, and I don't counsel on that. But I can promise you that combination
Absolutely.
is making it very difficult for
Yes.
people to cohabitate
That's
happily.
right. That's right.
Or at least share a bed
That's
happily.
exactly right.
And then headaches and motor vehicle accidents. And if you can pull up the one that says OSA-related accidents, this is astonishing. 80,000 individuals fall asleep at the wheel each day.
Day?
Each day.
Oh my gosh.
250,000 sleep-related motor vehicle accidents each year.
Yeah.
Drowsiness is a primary factor. Now, let's really hit this home here with the next one. Anything else? Let's talk about this. 50% of the diabetics have OSA.
Yep.
30 to 80%, depending on the study, of hypertensives has OSA. Stroke, heart disease, and cancer, these are the real trump cards.
And these diagnoses are as common as, you know,
Absolutely.
a dog wagging his tail. It's, you know, 3/4 of my clientele.
This is where a fella comes into the physician and says, yeah, I snore, but I feel okay. Or he has a sleep study and he tests out as a high AHI, and we'll talk about that in a minute, which is the apnea hypopnea. It's the number of arousals and lack of breathing. But he says, I feel pretty good.
Right.
It's analogous to hypertension. You may feel okay during the day.
That's right.
But you have to test it, and if you have it, you have to treat it, or it
Right.
will shorten your life.
That's right.
And
That's
it's the
right.
same thing with OSA. Increases the risk of stroke nearly 300%. If you have that one up there.
Oh.
This is what I'm talking about. The physician may tell this guy, I know you feel good, but this is going to increase your risk of stroke 300%,
Yes.
3 times. It's going to increase the risk of heart disease by nearly 2/3. I mean, if you tell someone this, it might open their eyes. But here's the kicker. We're going to go on through these. And cancer,
Oh,
the
man.
relationship of OSA to
Really?
cancer.
How much is that?
Mild sleep apnea are 10% more likely to die of cancer.
10%.
Those with severe sleep apnea were 4.8 times, almost 5 times more likely to die of cancer than those who did not.
Now, what causes that? The lack of oxygenation to cells, so
Well, and there's other issues with what we call inflammation, the inflammatory response of the body to this. And again, you know, I'm not a sleep doc, and I don't want to tread in areas that I'm not absolutely sure of. But this is the kind of thing that physicians are realizing that will make an impact on a patient who thinks this is really no big deal. All right, now we're going to go to one here, the last slide, and then we're going to switch gears. It says, let's review. If you can find that one, I think it might be number 29 or labeled 29. A middle-aged man that has severe sleep apnea is nearly 3 times more likely to have a stroke, 2/3 more likely to have a heart attack or die of heart disease, and 5 times more likely to die of cancer.
Oh my gosh, those are terrible statistics.
It actually is. And I had no idea. And I'm intrigued by this. And the reason I am is because there is a dental component to this treatment.
That's what is really fascinating to me.
Now, I have a little video. Where are we with time?
We need to take a break, and then we'll do the video when we come back. 'Cause
Perfect.
I'm not sure how long your video is, but we only got a couple minutes.
It's 5 minutes.
Okay, so we're going to take our first break, Lee, and we'll be back. Think of your questions now when Dr. Alston comes back with me, 407-1111. If you have sleep apnea, if your machine broke and you can't afford another one, I don't know what the scenarios are, but you all do. So give us a call at 407-1111, and we'll be right back in just a couple minutes. Don't go away.
Since 1976, Home Healthcare Supplies has been making life easier and better for you and your family. We carry a large selection of mobility aids to help you stay as active as you feel. Rolling walkers, hospital beds, wheelchairs, and bedside commodes designed to simplify your daily life. We have scooters and power wheelchairs and can install lifts for easy transportation. We have many solutions to help you, like our professional-grade orthopedics and Juxta-Light wraps, the perfect alternative to compression stockings. And peace of mind at home or away, with medical alert, help at the push of a button. And a natural drug-free erectile dysfunction treatment with a 98% success rate and results in as little as 5 minutes. We can help you with diabetes management, and our certified fitters will aid you with customized therapeutic footwear. We carry a great selection of post-mastectomy bras and breast forms, and our caring fitters will help you with all of your needs. Does Medicare or the Affordable Care Act have you asking questions? We have experts trained to provide you with the most up-to-date information. Call today and learn how you can save hundreds of dollars a year on your Medicare supplement and learn about different drug plans. With over 45 years of experience, come see why we are the Twin Counties' best home health care destination. Home Health Care Supplies. A better life for you, guaranteed. Call us today, 937-7006. You don't have to live with the pain and discomfort of carpal tunnel. Dr. Bloom and his orthopedic team can diagnose and treat you with a non-invasive surgical procedure that reduces recovery time. Randy Stewart is here for free carpal tunnel screenings to help you better understand the problems you may be having and how Dr. Bloom can help you. We are your family's orthopedic doctor, and we can see you today. Call to set up your free screening at 937-2663. Bloom Orthopedic Center at 3101 Zebulon Road in Rocky Mount.
Hi, I'm Richard Koss, Pharmacy Manager at Allman's Drug Store at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie.
We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Allman's Drug Store's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Almonds has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you.
As a loyal member of your community for over 70 years, you can count on Almonds Drugs to make the health of you and your family our top priority.
Please call Almonds Drugs today.
443-3138.
Hey, welcome back. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Rocky Mount Family Medical, and tonight we have Dr. Alston, who is educating us and giving us a fascinating overview, that's the word, thank you, of obstructive sleep apnea. And as a provider, I have only known that, you have a sleep study and then you get a CPAP fitted. And last time Dr. Alston was on, he started telling me about this, and I've been very excited because as a practitioner, I want all the available modalities that we can have for our patients. So I think when we took off for our break, we were going to show this little video. So we'll go ahead and do that, unless you've got...
Well, just to give it a little intro.
Okay.
I'm obviously a dentist, and this is a medical issue. But there is a dental solution for obstructive sleep apnea. I want to show the film first because it's a very typical scenario. It goes about 5 minutes, and it kind of shows the progression of the patient who discovers he has sleep apnea and is fitted with an oral appliance. So we'll show that, and then we'll come back and talk about it.
All right, awesome. Well, we're going to have I've never had a video on my show before. This is so exciting. And it's so exciting to have something new and innovative. And I'm just talking to you. Tell me to shut up because you're going to show the film, Lee. All right. Oh, here we go.
Honey, you stopped breathing again. I'm really worried. I think you should go see the doctor.
Obstructive sleep apnea, or OSA, can cause people to stop breathing for 10 to 30 seconds, sometimes for a minute or more, hundreds of times per night. Dentists who are trained in dental sleep medicine can provide an alternate therapy for snoring and sleep apnea using oral appliances. After being diagnosed, your sleep physician will discuss therapy options, including oral appliance therapy, CPAP, and surgery. People can stop breathing when the upper airway collapses, causing events of sleep apnea. Reduced airflow to the lungs results in lower oxygen levels in the bloodstream, affecting the brain, heart, and other vital organs, and can be life-threatening. Other signs of OSA may include frequent or loud snoring, choking or gasping. Left untreated, OSA can cause excessive daytime sleepiness and increase the chance for work and motor vehicle crashes. It also raises the risk for high blood pressure, heart attack, stroke, diabetes, obesity, depression, cognitive problems, as well as sudden death during sleep. Sleep apnea may be diagnosed at a sleep center by a sleep physician. Continuous positive airway pressure, or CPAP, is a standard treatment. CPAP provides a steady stream of air through a mask that balloons the airway open. While therapeutic for most patients in the sleep lab, many people cannot tolerate CPAP and do not use it every night at home as prescribed. Oral appliances used to treat sleep apnea look like sports mouth guards and are worn while asleep. These devices shift the lower jaw and tongue forward to open the airway. First, your dentist will review your responses to health questionnaires and take a medical and sleep history. Your dentist will examine your mouth, jaw joint, airway, and any necessary imaging such as x-rays. You will learn about oral appliance options, including benefits and possible side effects. After reading and signing an informed consent form, you may choose to proceed with oral appliance therapy. Your dentist will take impressions of your upper and lower jaws and may also take a record of a starting jaw position to optimize treatment success. He or she may use photographs to help monitor progress. Models of your teeth and the bite registration will be sent to a dental lab where the appliance will be made. A few weeks later, you will return to the office to be fitted with your custom-made oral appliance. The appliance will be adjusted to make sure it is comfortable. You will learn about cleaning and maintaining your appliance and any indicated adjustments. Then your sleep physician may perform a follow-up sleep study to confirm that the device improves your condition. You and your dentist will adjust the appliances necessary to reduce the snoring and sleep apnea symptoms. Several more follow-up visits may be necessary to ensure the appliance is working properly and that you are comfortable using it. The American Academy of Sleep Medicine's practice parameters recommend oral appliance therapy as a first-line treatment for mild to moderate OSA. Oral appliances are also recommended for severe sleep apnea patients who cannot tolerate or comply with CPAP. To find a dentist trained in oral appliance therapy, contact the American Academy of Dental Sleep Medicine at www.aadsm.org or call 630-737-9705. This video includes actors, but the dentist is a real dentist trained in oral appliance therapy.
All right, well, that was really interesting.
Well, it's pretty typical.
It sure is.
You were discussing the CPAP, or the continuous positive air pressure. Let me make a comment on that. That is still considered the gold standard.
Sure.
For severe sleep apnea, it is basically the device. The oral appliances that we're going to talk about are very effective with mild to moderate sleep apnea, and effective as well in severe, but they simply don't do as good a job as the continuous positive air pressure. And there's as you know, there's developments beyond CPAP. There's bi-level pressure. There's automatic adjustments now. But the problem with CPAP, as good as it is, and it actually cures it, I mean, it knocks it out. It forces air down the airway and opens up the airway, and when it's adjusted to the proper pressure, the patient will actually normalize. They will not have these apneas and hypopneas, and all these associations that we're talking about disappear. But the compliance is the issue with the CPAP. One of the things I was reading is that 30%, or almost a third, of the patients who are prescribed CPAP never go.
Really?
Never show up. And if you compare the oral appliance versus the CPAP, if you consider 4 nights a week and a reduction in the HTYGH successful, then the oral appliances are over 75% successful and the CPAPs are less than 50, 30 to 80% depending on what you read. So with the best of intentions, a lot of people start the CPAP, but they can't get fitted properly. The straps may not fit right. They can't adapt to the mask over their face.
Right.
And so this is where the oral appliance comes in. Now, how do you know if you are a candidate for an oral appliance? Again, it would seem logical to go to the dentist. And that's a fine place to start. We can all do an examination of the mouth. We can give a sleepiness test. We can ask the proper questions, but we can't make a definitive diagnosis. Only a physician can do that with a sleep study, and that's a polysomnogram.
Right.
So no matter where you start, you have to be diagnosed with a sleep study. Now, following the sleep study, the physician will make the recommendation.
Right.
Some people are intolerant to the CPAP. Some people refuse the CPAP. And this is an alternative therapy for those people, and it's certainly better than nothing. You were asking about the primary snorer earlier. The fellow who actually does snore goes and has the sleep study and doesn't have sleep apnea.
Right.
But he wants to quit snoring.
Right.
This is absolutely spot on for that because it will eliminate the snoring and improve the quality of life, at least certainly for his bed partner. Now, we're going to look at these for a second, these oral devices. I don't know if he can get a close-up here.
Can you do a close-up, Lee?
You probably can.
But how do they work? Well, again, we're talking about a collapsed airway. If you take your lower jaw and protrude it until your teeth are edge to edge and try to snore, you almost can't.
There you go. You can pick it up.
There you go. These devices, I'm going to show a couple of them, this is an acrylic version. It's called the dorsal device. And it's plastic. It snaps over the upper and lower teeth. It's called dorsal for a reason. It looks like a couple of dorsal fins. It snaps over the lower teeth. It snaps over the upper teeth. It's adjustable, and it can be managed over even crowns or even temporaries, and it can be adjusted to fit. And when it's placed, it holds the mandible in a protruded position relative to the upper jaw. In other words, it holds it forward. How that works is, the tongue, of course, is anchored to the mandible. The jaw is held forward, the tongue is pulled forward away from the pharynx, and the pressure on bringing the jaw forward also widens, or in a lateral version, opens up the airway. So what this does is it literally opens the airway. It prevents the tongue and the soft palate from collapsing over the pharynx.
Fascinating.
And it's effective. Like anything else, there's some limitations. One has to have a dental exam. One has to have enough teeth to support the appliance, and the teeth have to be healthy. So we have to basically screen the patients for everything else that they could possibly have, missing teeth, periodontal disease, because these appliances do have some side effects. They put some pressure on the teeth when the jaw is held forward. So the patient has to have a reasonably healthy dentition to even qualify for this. Now, here's another device. This is basically some telescoping rods, and this is one that's actually is approved by Medicare. They had a funny qualification a few years ago. I think it's going to change, that they have to be attached. The upper and lower components have to be attached.
Oh, so that's what you got that thing for.
Exactly.
Okay.
Now, here is the latest and greatest. And this is funny. We were talking earlier about this appliance. This company, ResMed, used to make CPAPs, right? And they kind of poo-pooed oral appliances as being relatively ineffective. This is 10 or 15 years ago. Well, now we see who is making the actual oral appliance. I mean, the oral appliance is ResMed. It's a market, and it's an effective appliance. The nice thing about this is made out of almost like a Kevlar material, a centered nylon, and it's made from a CAD/CAM process. It fits very well, and it's lightweight, and it's easy to adjust. And let's talk about adjustability. A dentist basically takes a bite registration at a protrusive position, usually 50 to 60% forward, which is a starting point, and he can test in the mouth how the patient responds to this protrusive position, and he makes the appliance there. This position may not be ideal for everyone, so it has to be titrated, and these have to be adjustable to allow more protrusion or less protrusion. They have to be adjustable until the patient finds the exact right position where the snoring disappears. And then how do you know it works? You have to do a sleep study with it in the mouth.
Oh, okay.
So you can put it in, you can wear it, you can feel better, and I'm going to show you, because this is mine. And I'm going to show you how easy this is to put in. I don't know if you can see this, but it's basically snaps in, and that's it. I can talk with it in, kinda. But it's unobtrusive once you have it in. The only symptoms I ever have from my appliance, and this is my second one, is occasional dry mouth. And I think the appliance tends to desiccate the soft tissues a little bit. But it is an effective appliance, and now the matter is simply getting the dentist and the physicians on the same page.
Right.
Right?
That might be a
Well,
challenge.
and we'll talk about that. Do we have to take a break, or can we just keep going?
We can go for 4 more minutes.
Okay. Here is where the physician has to understand that this appliance is actually effective. And it's the responsibility of the dentist who would like to provide this to basically convince the physician that the appliance is not only useful, but it's going to be maintained. I will tell you right now that if you put up a sign and that says I can cure snoring, people will beat your door down. I can make this appliance for anyone, they'll quit snoring, but unless they have a sleep study, I don't know if it's effective in reducing the severity of obstructive sleep apnea. The physicians need to see that the dentists are committed to the medical side and not just make an appliance and collect the money. So the protocol is typically, whether he starts in my office or the physician's office, a sleep study is recommended based on the symptoms and the examination. Following the sleep study, the degree of severity is established. Other sleep hygiene measures might be recommended, but if it's obstructive sleep apnea, CPAP or oral appliance. Simple enough. The physician has to write a prescription to me to provide this appliance for his patient. He has to have confidence that I can deliver an appliance, that I'm not a one-trick pony, that I can have 2 or 3 appliances. Some are adjustable in different ways. Some patients don't respond as well to one or another. And I have to have a little bit of a medical background in this so that I can assess this patient rather than just how the appliance fits. And then I have to send this patient back to him for follow-up care. And as long as the dentist and the physician are on the same page, I think this is a very useful mechanism. Physicians like literature, they like data.
Oh, yes.
And there is literature and there is data now that absolutely establishes that this is a device that delivers the goods.
That is awesome. So once you have it, I've got my patient, and he did the Epworth Sleepiness Scale, and he qualified for his insurance to pay for that. And he's a moderate. Then I can just call you and say, I've got this fella or this gal, and I want to send them to you.
And when you send them to me, my reception is going to ask for a copy of the doctor's notes, a copy of the review of symptoms, a copy of the sleep study, and a prescription for the oral device. So I can see this patient, but I'm not going to deliver this appliance until the physician has recommended it and actually written a prescription for it. Now, if this patient shows up in my office without that, I can examine him, I can contact the physician and say, I think this is a candidate for oral appliance therapy, and would you review this and consider him for this appliance therapy? In other words, write me a prescription so I can provide this. But we're not going to circumvent that protocol. And the American Academy of Dental Sleep Medicine is intent upon suggesting and having the members follow that protocol. Because the knock on the dentist in the past is just simply not doing this from a medical standpoint, just making an appliance.
And you're always going to have somebody that's in there just for the money.
Well,
and that, one bad apple spoils the barrel.
Well, that's right. And whether this is lucrative or not, most of the dentists I've talked to said it's a tremendous loss leader the first couple of years as you get patience and get experience and have to do some things over. But it's rewarding. It's the same thing like straightening teeth and taking the braces off. I did this twice a day. The mom and the children were absolutely thrilled at the result. This is something where you're actually possibly saving someone's life. We discussed this earlier. My fiance is from Florence, South Carolina, and she informed me before I came on that 2 ladies in Florence died in their sleep last year and were diagnosed with obstructive sleep apnea. This can kill you. And if I can do something like that, well, that's
going to be a lot better than making some young girl look pretty.
Well, I don't know.
That's pretty important too.
I think it is.
All right, we're at a stopping point right here, so we're going to take our next break, Hang on now. Y'all be calling about questions. I know there's some CPAP people out there. I know that. And so if you've got a question for Dr. Alston, give us a call, 407-1111. We want to hear from you. All right, hang on. We'll be back in just a minute. Don't go away.
I want to ask.
Hi, I'm Richard Koss, Pharmacy Manager at Allman's Drugstore at the Westridge Shopping Center. Here with my wife, daughters, and my business partner, Brad Hilton, and his wife, Katie.
We are delighted to be new business owners living in Rocky Mount and are excited about the new services and products we are adding at Allman's Drugstore's 2 locations. With a full-service pharmacy, a large supply of over-the-counter supplements, and a comprehensive line of diabetic supplies, Allman's has you covered. Our pharmacists also specialize in consultations. We want you to pay the lowest prices and get the best service in town, and our staff works hard to help you save money, but we are also big on friendliness and customer care. We will deliver your prescriptions free, have drive-through windows, and guarantee short wait times. And we come out to greet you personally and see how we can answer all of your questions. Because as local business owners, we care about you.
As a loyal member of your community for over 70 years, you can count on Allman's Drugs to make the health of you and your family our top priority.
Please call Almond's Drugs today.
443-3138.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently. So we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
You don't have to live with the pain and discomfort of carpal tunnel. Dr. Bloom and his orthopedic team can diagnose and treat you with a non-invasive surgical procedure that reduces recovery time. Randy Stewart is here for free carpal tunnel screenings to help you better understand the problems you may be having and how Dr. Bloom can help you. We are your family's orthopedic doctor, and we can see you today. Call to set up your free screening at 937-2663. Bloom Orthopedic Center at 3101 Zebulon Road in Rocky Mount.
Alrighty, we're back. This is the last part of our show. It's been just fascinating, and we heard from a caller during the break that there was a train accident in New Jersey, I don't know, year and a half ago. And is this the guy that they thought was texting?
I believe that's the
Yeah,
one. The one
and he
the
was a
Hoboken.
conductor on a train, and they've just determined that the cause of that accident was that gentleman had sleep apnea. So it's just really pervasive. It's all over, and we need to get everybody healthy and everybody on board. So this is Dr. Alston, and he's been just educating us beyond measure, and he's going to keep on talking. So go ahead, Dr. Alston.
I'm going to have Lee put up the Epworth Sleepiness Scale. If you can find that one, it was one of those first 4. And we've been sitting here talking about this, and if you've been listening, you might think, well, I can't go get a sleep study tonight, but I might be suspicious that I have it. I don't know that I snore, particularly if you sleep alone, but this Epworth Sleepiness Scale that I'm going to have him put up here is something that anyone can take. You can pull it up online. If you go to your physician's office or in the future to a dental office that provides this, this is one of the things that we do.
There it is.
And it's one of the things that the insurance companies like to see.
Yes.
And it's scored. And we don't have to score it right now, but if you just think about whether you do or not, do you doze or tend to fall asleep when you're sitting or reading? All right, do you do this when you're watching TV? Do you do this when you're sitting inactive in a public place? As a passenger in a car for an hour without a break? By that definition, I think everybody I know has it. I don't know anybody that can stay awake in the car with me.
It's not dry.
Particularly my kids. But I think that was because they didn't like the music that I played.
Probably.
Lying down to rest in the afternoon when circumstances permit, do you fall asleep? Here's the other one, sitting and talking to someone. Now, my fiance thinks this is rude, and I tell her, I've got some sleepiness issues. I'm trying to treat it, but I actually do that sometimes. It's not because she's boring.
Right,
Don't go
right,
there.
right.
But I actually will tune out sometimes, and I can tell that it's because I'm sleepy. Sitting quietly after lunch without alcohol. If I eat lunch and quit moving,
Well,
I can
yeah.
take a nap.
All right, we're going to take this call.
Okay.
Hey there, this is Linda and Dr. Alston. How you doing?
Hi, how are you?
Great.
I had a couple of things I wanted to share after watching the show.
Okay.
I was actually a rep for CPAPs, a medical sales rep for 4 years. And one thing that I found out through this, about 60% of all the people that wore CPAPs were not compliant, and they just absolutely quit wearing them. And it is very important, and I think it's growing more and more, especially for women. I just really wanted to kind of add this on, that if you've never had a sleep study, when you go for your yearly exam, you should request one. And your general practitioner can get this done for you, and it's just the amount of people that I've seen really struggle over the years that didn't realize that they had it. And it should be part of your routine checkup, and more general practitioners are doing this. So if you've never had one, I just wanted to say that it would probably be in your best interest. I've seen a lot of really sick people, and a lot of people die from just not knowing that they had it. So
That's a great
I found
point.
the show very interesting, and I just wanted to add my input on that.
Well, thank you, Christy. That is awesome. And as a practitioner, I'm going to have to put that in the back of my head for all the complete physicals I do on men and women. So thanks so much for your call. Do you have anything to add, Dr. Alston?
Well, yeah, I would follow up on that. If you're diabetic and you're obese, there's a 70% chance that you have sleep apnea. And so I think if you have these other comorbidities, then if the doctor doesn't bring it up, and I would imagine he is going to, then it should be a request. And as Christy has said, you might even want to request a sleep study.
Right.
This is really practically epidemic.
Yeah, I can see that.
And
Another interesting thing on that too is personally, I have chronic fatigue syndrome that I was diagnosed with, and the first thing that they did was send me in for a sleep study.
Absolutely.
And that's one thing. Anybody that's got any fibromyalgia, chronic fatigue syndrome, you really need to be proactive in this. Some doctors do, and some doctors don't.
Right.
But I think this is just as routine as getting your teeth cleaned or just a regular checkup once a year. You need to check on that sleep apnea. But that's all I wanted to offer. And,
well, I have a question for you.
I enjoyed your show.
So, Christy, I have a question for you.
Yes.
So you have chronic fatigue syndrome, and have you had a sleep study?
I did have a sleep study done, and everything luckily was okay for me.
Okay.
But I do know, and again, because I did rep the CPAPs and all that, I have a list of people I know that actually do suffer from some fibromyalgia and the chronic fatigue syndrome that do have that.
Okay.
So it doesn't always come, it was an overweight, thick neck type person. It can be a very slim female. It comes in all shapes and sizes these days. So just don't take anything for granted.
All right. Thanks so much. We appreciate your call. You have anything else?
Okay, thank you. Have a good night.
Good night. Well, that was an awesome call.
That's great. Obviously, a very knowledgeable person. She said she repped CPAPs in the past, so we know where she's coming from. And let me say that this is not a show to discourage CPAP.
No.
Those folks, I know LendCare will send a respiratory therapist and a technician to your home.
Yes.
They will help you fit this. They will do everything they can to make it successful, and yet still the compliance is low.
Right.
And this seems to be a much more acceptable device, and in fact the literature shows that it is. The compliance is higher with an oral appliance.
Right.
But guess what? You have to wear this too.
Still have to put it in.
You still have to put it in every night, and you have to wear it. And almost certainly, if you wear it and it stops your snoring, your bed partner is going to remind you to wear it.
Where's that device, honey? Put it on.
All right, now, let's see. Do we have anything else we have to cover before we're finished here?
Well, that's up to you. I don't think so, although you might want to talk a little bit about your office, how people can get a hold of you, where they call. Can they then can they tell you that they saw you on TV and they want to have
Sure.
have a test, or tell the audience how to do that?
Yeah, let me speak for all the dentists in the neighborhood. And I'm not familiar with exactly who is doing this right now, but there's not a lot of oral appliance therapy in the area, and I know that from talking to an ENT doctor and from the sleep doctor. If you want to pursue this, if you're sitting out there and you are a CPAP non-compliant patient, you know you have obstructive sleep apnea, you think an oral appliance would help you, the first thing to do is probably at any next dental checkup, ask your dentist if you qualify, or ask your physician. In other words, you don't need to come to me tomorrow. Your dentist is a good gatekeeper. He may not provide this appliance, but he could tell you if you are a candidate for it. But more importantly, if you're sitting out there and you've taken the sleepiness scale, you think you might have sleep apnea, it's call your physician. Now,
Okay.
how do you get to me? As again, it's going to be a prescription from the physician to me. But if you end up in my office without that, we will examine you. We will tell you if you have enough teeth. We will tell you if your teeth are healthy enough to support this appliance. And then if you are a candidate, we will ask your physician for a prescription, or ask him if he thinks you are a candidate for this.
Right.
And again, we're not trying to corner the market.
No.
We're not trying to
It's just
put CPAP out. We're presenting this as a viable alternative treatment for obstructive sleep apnea.
Right. And insurance covers this, does it?
It does. Remarkably, it's covering less as insurance goes. The payments on the appliance is getting a little bit less. Patients are probably going to be faced with a higher co-payment. This is one of the reasons that a lot of dentists are not doing this, because this is a medical device and can only be billed through medical insurance. Dental insurance does not
cover it.
recognize this, does not cover it. A lot of offices are not equipped, and this is why right now I'm not saying call me in the morning,
Right.
because we are installing the software right now that allows us to coordinate our billing with a biller who will collect medical insurance for us. And that's not an overnight deal,
Right.
particularly for
Oh,
a
yeah.
dentist.
That's
And
right.
people that try to collect insurance premiums in medical offices know what kind of hoops you have to jump through. So we want to be prepared. The first thing a patient is going to do when they walk in our office, if they think we provide it, is ask us, how much does it cost?
Oh, yeah.
And does insurance
Absolutely.
cover it?
Yep.
And
Yep.
until I can answer those questions, I'm not prepared for you.
That's
but
right.
we're coming up to speed. What are we doing personally? We're going to now do our little pilgrimage to educate the physicians, and I don't mean that condescending. I'm talking about let them know what we can
Right.
do.
That's right.
Because we are working for them and the patient. We have
That's
two
right.
masters. We want to please the physician with our therapy, and we want to make the patient feel better. And so, and I think any dentist in the neighborhood that does this, I think Dr. Hunt is qualified to provide this appliance. I know we are, and we will be ginning this up in 2017. So if you do call the office tomorrow, we're probably going to write your name down, get your phone number,
On a list.
and tell you when we can schedule you for an initial exam.
Awesome. This has been so fascinating. I was really excited when he came last time, and because he said he had something about obstructive sleep apnea. I had no idea what it was, because I haven't, as a provider, I have not heard of it.
Yeah.
And I'll bet everybody else that I work with hasn't heard of it,
No, it's
unless they're well versed in dental
well, that's
procedures.
That's it. And Dr. Jarvis, Benny Jarvis, is a fabulous ENT doctor here in town. And I know her. I treated her children, and I would consider her someone who respects me. But even Dr. Jarvis said, when you get a couple or 3 or 4 happy patients, then you come see me, and we'll talk about working together on
Okay.
this. As good as she is, as knowledgeable as she is, and I think she knows that I can deliver this, she's still a skeptic because she's had a few instances in the past where appliances didn't work, and she wants to see some success.
Right.
And when we deliver that, I think there's an opportunity for working hand in hand with ENTs and the sleep doctors and providing this for folks on a regular basis.
That's wonderful.
I'd like to see where we are 2 or 3 years from now. I think we'll be providing a service to the community.
I think it's awesome. All right, we've got 1 minute. If anybody has a call, 407-1111. But go ahead and give them your contact information, where your office is.
Oh, sure. I'm right here in Rocky Mount. I'm at 120 Clinton Court. My phone number, office number is 451-1010. My receptionist is Andy, who will screen these calls. And as I said, if you're calling tomorrow for braces, you'll probably be appointed at the next available appointment. If you're calling tomorrow inquiring about an oral appliance, mandibular repositioning device, she's going to take your name and number, and then she will call you back with an appointment and tell you what you need to bring to the appointment. But she also, before you come back, not just her, but we should know what benefits you have, we should know what your insurance provides, and we should know when you've seen your physician. So we're going to be asking you to bring things to our office. But again, I'm an orthodontist. I straighten teeth Monday through Wednesday, just as many as I can, and we're going to look forward to adding this into our armamentarium at our office, probably for the next 5 or 6 years.
That's awesome.
I
I'm so excited for the people of this city and this area, because this is something that is just, cutting edge as far as I'm concerned. I'm not sure if that's really the correct term, but anyway, it's time for us to go. I appreciate the call. I appreciate everybody. I know you've been watching. I just know it, and you're just too shy to call. And so we're going to have Dr. Alston back again at some point. I don't know when, probably after the first of the year. When
I can talk about anything.
There you go, see, and so can I. So we just have to learn how to not talk over each other.
I would add one thing. If you're having trouble sleeping recently, like in the last week, I would wait until you've gotten over the election. And then reassess.
I don't know that people are going to get over that election. I'll tell you what, that has been something.
Anyway.
I've had many conversations about that in my office.
That's my only political comment.
There you go.
tonight.
That's right. All right. Good night, everybody. Thanks so much for watching, and we'll see you next week with more of Here's to Your Good Health. Good night.